In this lesson, we will be looking at the topic of hypertension. Before we look at hypertension, let's first look at what the factors affecting blood pressure are. Cardiac output is the volume of blood pumped out by the heart per unit time. If cardiac output increases, blood pressure would also increase. Cardiac output is in turn affected by heart rate, preload, which is the volume of blood in the ventricles just before the heart contracts, afterload, which is the resistance that the heart must overcome to pump blood out, and myocardial contractility, that is the strength with which the heart contracts. Blood pressure is also affected by peripheral resistance. This is the resistance that must be overcome for blood to flow through the circulatory system. Resistance is affected by a few things. Firstly, the flexibility of the artery walls. Healthy arteries are elastic. So during systole, when the heart pumps blood out at a high pressure, an elastic artery can expand and absorb the shock of the high pressure. Secondly, artery diameter. If there is vasoconstriction and the arteries are narrow, that increases the resistance to blood flow and the blood pressure would increase. Thirdly, blood viscosity, which is how thick the blood is. Increased blood viscosity increases resistance to blood flow. A normal blood pressure is less than 120 millimeters of mercury during systole, which is when the heart contracts, and less than 80 millimeters of mercury during diastole, when your heart relaxes. Hypertension is defined as a condition of persistent high arterial systolic and/or diastolic blood pressure at rest. So if both systolic and diastolic pressure are high, obviously that would be considered as hypertension. What if, let's say, only the systolic blood pressure is high, but the diastolic blood pressure is normal? That would still be considered as hypertension. Another keyword here is persistent. Persistent high arterial systolic or diastolic blood pressure. So to diagnose hypertension, at least 2 blood pressure readings on separate occasions should be taken. In the US, hypertension is defined as 130/80 millimeters of mercury or greater. However, in Singapore and in many other countries, hypertension is still defined as 140/90 millimeters mercury or higher. In Singapore, we do recognize that 130/80 is higher than normal, but it is called high normal instead of hypertension. Hypertension usually does not result in any symptoms. That's why it's called silent killer. Some people may report giddiness or headache if their blood pressure is very high, but this is not very common. Fortunately, it's not that hard to detect hypertension. Just measure the blood pressure. It is important for hypertension to be detected early because uncontrolled hypertension can eventually cause damage to other organs in the body, such as the heart, kidneys, eyes, and brain. Let's look at the types of hypertension. The most common type of hypertension is primary hypertension or essential hypertension. There is no one direct cause for primary hypertension. Rather, there are many different risk factors that contribute to it. For example, smoking, obesity, hyperlipidemia, and diabetes. Another type of hypertension is secondary hypertension. The hypertension is secondary to a disease, meaning the hypertension is directly caused by another disease. For example, maybe the person has a brain tumor which causes pituitary gland to secrete ACTH, a hormone, which signals for release of excess aldosterone. Aldosterone then causes salt and water retention, which increases the blood volume and causes hypertension. Or maybe a person has kidney failure. If the kidneys are unable to excrete the excess water, then the blood volume will increase, which then causes hypertension. Or let's say someone has a disease of the adrenal glands and is overproducing the hormones epinephrine and norepinephrine. That will also increase the blood pressure. Some pregnant ladies have gestational hypertension. That means they have high blood pressure during the later half of the pregnancy, but it goes away after the baby is delivered. I also want to mention isolated systolic hypertension, which is a type of hypertension where the systolic blood pressure is high, but the diastolic blood pressure is normal or even low. This is more common among the elderly and is caused by arterial stiffness. Let's look at the diagram which describes how arterial stiffness leads to isolated systolic hypertension. In a young, healthy individual, the arteries are elastic. During systole, the heart pumps blood out at high pressure. The large arteries would then expand and absorb some of the pressure. During diastole, while the heart is relaxed, the arteries that have expanded will then recoil and push the blood forward. In aging, the arteries become more stiff. So during systole, the stiff arteries will not be able to expand to absorb some of the pressure. This results in a high systolic blood pressure. During diastole, there is also no elastic recoil to help to push the blood forward, so the diastolic blood pressure would usually be low. As mentioned earlier, primary hypertension does not have a direct cause, but there are several risk factors including older age, family history of hypertension, obesity, sedentary lifestyle, smoking, high salt diet, alcohol, stress, and other medical conditions, for example, diabetes, kidney disease, and sleep apnea. If hypertension is not controlled, over time it can cause many complications. Let's look at the complications on the heart. Hypertension is a risk factor for coronary heart disease. The high blood pressure can damage the artery walls, making them more vulnerable to plaque buildup. This can then lead to coronary artery disease like angina and myocardial infarction. Hypertension can also lead to left ventricular hypertrophy. So what is this? Hypertrophy means enlargement due to the increase in the size of the cells. So since the blood pressure is high, it means that the heart has to pump blood out against an increased pressure. Since the left ventricle has to pump blood to the different parts of the body, that means the left ventricle will be more affected since it has to work harder to pump against that increased pressure. So in order to work harder, the cardiac muscle fibers become enlarged. But in the long run, this is not a good thing because the enlarged muscle fibers need more oxygen. And with this increased demand for oxygen, there is a higher chance that the supply of oxygen may not meet the demand, and this will cause the heart muscles to die. Eventually, this can lead to heart failure. In fact, hypertension contributes to about 70% of congestive heart failure cases. Hypertension can also lead to stroke. There are two kinds of stroke, hemorrhagic and ischemic stroke. Hemorrhagic stroke occurs when a blood vessel in the brain bursts, which then causes bleeding in the brain. Ischemic stroke occurs when a cerebral artery is blocked, usually by a blood clot. Both types of stroke can be caused by hypertension. Hypertension damages the blood vessels. It could damage the blood vessels in the kidneys, affecting their ability to filter blood effectively. This results in chronic renal failure. It could also damage the blood vessels in the retina, which can lead to loss of vision. This is called hypertensive retinopathy. Besides medications, lifestyle modifications are important to help control hypertension. Regular exercise is important. A good amount of exercise would be at least 30 minutes of exercise, 5 to 7 days a week. For those who are overweight, losing weight can also help to reduce the blood pressure. Smoking increases blood pressure due to its nicotine content. So quitting smoking can help to lower blood pressure and also reduce the risk of heart disease. Reducing salt in the diet also helps to lower blood pressure. Alcohol consumption should also be limited to at most 2 drinks per day for men and 1 drink per day for women. A healthy, low-fat, high-fiber diet can also help to reduce blood pressure. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is a diet that has been well studied for hypertension. After completing this section, you should be able to define hypertension, describe its risk factors and complications, and state what lifestyle modifications can be taken to prevent and control hypertension.